Prediabetes, diabetes, high blood pressure, high cholesterol are more common than you think. Nina the Food Doc here, registered dietitian nutritionist of 15 years, and most of my clients who come in have either prediabetes, diabetes, high blood pressure, and high cholesterol. And I'm going to tell you exactly like I tell them. So let's get into it. Well, let's start with diabetes. Some of the more common symptoms include extreme thirst. You just cannot get enough to drink. And unfortunately, those who don't know that they have diabetes tend to want to quench this thirst with like juices and sodas and other sweet drinks just to quench their thirst, when all the while their blood sugar is just going up and up and up and up. So, extreme thirst, going to the bathroom a lot, to urinate, just is going out as fast as it's coming in. Increased hunger, sometimes blurry vision, unexplained weight loss. You're losing weight and you're not really trying. And then last but not least, you have cuts or wounds that are not really healing like they're supposed to. So those are like the classic, I would say the classic symptoms of high blood sugar would be going to the bathroom a lot, extreme thirst. If you're having any of those symptoms, you might want to get your blood sugar checked. For those with diabetes, here are some nutrition tips to kind of help regulate that blood sugar a little bit better. You want to start being snobbish with the types of carbohydrates that you choose, meaning you choose carbohydrates that are high in fiber. Now you'll hear the term complex carbohydrate. That just means fiber containing carbohydrate. So if your carbohydrate does not have any fiber in it, find you another carb. Okay, so there's things like oats and legumes, vegetables, high fiber carbs, or fiber rich carbs rather, will help slow those blood sugar spikes. So try to include those types of carbs in your diet instead of trying to cut them all out. Another thing you can do is limit your added sugar intake. You don't need them. You really don't. And the refined grains. So refined grains are those grains that don't have any fiber, like your white bread, your regular pastas, your pastries, things like that. So to keep your blood sugar in check, try those two nutrition tips. Now, as far as the lifestyle factor goes, try moving after a meal. That'll help the post-meal blood sugars. If you get up and maybe walk about 10 or 15 minutes, that could help bring those blood sugars down. So the main difference between type 1 and type 2 diabetes. Type 1 diabetes is typically diagnosed at a young age, and they are insulin dependent. Their pancreas does not produce any insulin, so they have to have insulin. Type 2 is typically diagnosed later on in age. Like they usually call it adult onset diabetes. And it may or may not require insulin. From prediabetes. Now, there are really no overt signs and symptoms of prediabetes, which is why you can have prediabetes for years and not even know it. So that's why it's so important for you to check in with your primary care provider at least once to 2 times a year to check your lab work. Okay, because the prediabetes is one that can kind of sneak up on you. So here are some risk factors for developing prediabetes. Sedentary lifestyle, being overweight, especially in the abdominal region, family history of diabetes type 2, and polycystic ovarian syndrome, PCOS. And also, if you have gestational diabetes, that increases your risk of developing prediabetes later on. So here are some nutrition tips for dealing with prediabetes. Definitely balanced meals, lean protein, fiber-rich carb, healthy fat every time you eat. Okay, that'll reduce your insulin resistance if you do that. And then, of course, avoiding sugary drinks again, and a lot of your processed snacks to keep that blood sugar or blood glucose steady. And a lifestyle tip would be to stop sitting so much. Reduce the time that you're sedentary during the day. Stand up. If you have those sedentary job positions, try getting up. And I would say every hour to at least stretch and move your body. And yeah, if you're drinking enough water, this should not be a problem because you're going to be going to the bathroom anyway. Now let's talk about high blood pressure. It is not called the silent killer for no reason. Because a lot of people, they will have elevated blood pressure and not even feel it. Show no signs, show no symptoms.